ICU occupancy is extremely high statewide. It's been climbing steadily for the past month. It's really reaching, I would say, crisis levels.
A crisis. The latest data released by the Oregon Health Authority showing 94% of ICU beds are now full in Oregon, and OHSU saying 93% of their COVID patients are unvaccinated. It is 10 o'clock. Good evening, everyone. I'm Jeff Gianola.
And I'm Elizabeth Din. Another thing to keep in mind tonight, not only are we seeing record numbers of daily cases and more people in the hospital than ever with this virus, the surge is happening twice as fast as the big one last November.
We saw a single-day record this week with cases rising 243% in just the last month. Compare that to last fall when we saw a 1,700 case peak on November 30th. The month leading up to that only saw a 123% rise in cases.
And as hospitals fill up, patients facing new rules about who can and cannot come and see them.
And our Jenny Young has more on that from OHSU tonight. Jenny?
Jeff, Liz, OHSU releasing an urgent statement tonight saying that starting tomorrow, most patients will not be allowed visitors. That does not include labor and delivery, pediatrics, or end of life. But even those visitors will have to be vaccinated or present a negative COVID test. OHSU saying that they will keep this rule in place until the surge declines.
Gentlemen, please understand us when we say this is real. This is happening. What we are seeing today is different than what we have ever seen before.
Dr. Scott Nelson is one of half a dozen healthcare professionals in Josephine County who stood before county commissioners this week, describing dire circumstances hospitals face as COVID-19 cases and hospitalizations surge in Southern Oregon.
This Delta variant is not what we have seen before. And so unfortunately, all of these thoughts and ideas that we have had have to go out the window.
Current numbers from OHA show 94% of staffed adult ICU beds in Oregon are occupied. And of the COVID patients in those beds, most are unvaccinated.
The vaccine was never touted to be 100% effective, and we're seeing that. But it is very effective in that it's keeping those people that are infected pretty safe compared to the ones that are unvaccinated.
Dr. Megan Frost is a surgeon at Asante Three Rivers Medical Center in Grants Pass. She told the Board of Commissioners the hospital has been forced to cancel elective surgeries. She says an elective surgery might sound like a hernia repair or a hip replacement, but the reality is they're not doing any operations unless someone is dying.
I spent all of last week, and I'll continue to do it this week and next week and the following weeks, to call all of my patients that have cancer to tell them, I'm sorry, we cannot do your cases right now. I don't know when we're going to be able to do your cases. In the best of circumstances, we're looking that it's going to be a couple of months. In the worst of circumstances, it may be next spring.
We asked OHA if there are any plans to relocate patients in Southern Oregon to hospitals here in the Tri-County area and found out there are. We also reached out to every major hospital in the metro asking about bed capacity and surge plans. Each told us they are prepared in the event of a surge. Kaiser Permanente told me that they'll have tents outside each location for surge. OHSU saying they have surge capacity, the space, but they would have to find healthcare professionals to staff that space. OHA says that they've been in contact with FEMA and the U.S. Department of Health and Human Services about how they would staff field hospitals. They had meetings with them today. They'll have more tomorrow, so we will continue to follow this closely. We'll let you know what we find out. Reporting live tonight, Jenny Young, KOIN 6 News.